I have an order to administer Bob Johnson in room 102, 4 milligrams of IV Zofran push. So the first thing I'm going to do is I'm going to go ahead and go into my MAR, and I'm going to check that I do have Bob Johnson an order from Dr. B, and I'm going to administer the medication via the 6 rights, so right med, right dose, right patient, right route or right time, right documentation, and right route. So that again is my first check in my medication administration again. We're going to do this again at the patient's bedside and obviously right now as we are withdrawing our medication. So the first thing I'm going to do is I'm going to pull out my vial of Zofran, and I see that it doesn't have any particulates. It's a single dose vial of Zofran, so we will be throwing this away after we are done using it. So our bottle of Zofran here calls for 2 milligrams per 1 mil, and Dr. B has ordered 4 milligrams, so we are going to have to draw up 2 mils of our Zofran to push that in for our patient. The next thing we're going to do is we're going to go ahead and gather up our supplies, and we're going to head into the patient's room. So grab all my stuff, and so I need flush, 3 mil needle, and then some alcohol swabs and my gloves.
Come on in.
Hi, Bob. My name's Ashley. I'm your nurse today. How are you doing?
Good, Ashley. How are you?
I'm good.
Are you going to give me something to help me with this terrible nausea?
I am. I have an order from Dr. B to give you 4 milligrams of Zofran via the IV push. See, so I told you that the IV, keeping that there, was going to be the best option for us.
I know it. I feel so nauseous I can't even watch Bonanza.
I know. I'm so sorry. So we'll get that going here for you, and then hopefully it'll help right away. So, Bob, do you have any allergies? Have you ever had this medication before?
I've had this medication before, and I did just fine with it, and I don't have any allergies.
Perfect. No adverse reactions.
Nope.
Okay.
Nope.
So I'm going to go ahead and just check that against the MAR. Bob, can you give me your name and date of birth, please?
Bob Johnson, 1165.
Perfect. And I do see that that's correct on the MAR. It doesn't say that he has any allergies on the MAR as well. So that all checks out. It's very good. I'm going to go ahead and wash my hands. And then I'm going to go ahead and raise the bed to a comfortable height because I'm fairly tall, so it needs to be up higher for me.
Is this why I feel like I'm floating off the ground?
It is, it is. I'll put you back down as soon as we're done, okay?
Okay, that's fine.
All right, so I'm going to check out this site, make sure that there's nothing that's going to cause me to not give this IV in this site. Skin integrity is good. The IV site looks excellent, so we are good to administer that. So we're actually going to administer, like I said, the 4 milligrams via IV push. So that means we're going to administer, because it calls for 2 milligrams per mil, we're going to drop 2 mils of that IV. And now Zofran, in addition to that, it causes, we have to give it a push over 2 mils per 1 minute because it causes nausea, vomiting, dizziness, some ringing in the ears, deafness, kind of confusion, that kind of thing. So, Bob, I just want you to make sure the whole time I'm going to be talking to you and making sure that you can still hear me, that you don't have any ringing in your ears, that you don't feel dizzy, and I need you to tell me, too, if you do feel any of those things, any immediate burning, pinching, anything like that, okay?
I can do that, no problem.
Perfect. All right, so the first thing I'm going to do, I'm going to go ahead and throw my gloves on. And we're going to just prep our stuff here. So I'm going to go ahead and take an alcohol pad, and we're going to lay this flat. It's going to be our sterile area for our saline. I'm going to go ahead and prep that there. Perfect. We'll set that right there. Go ahead and take my needle out. And I'm going to draw up 2 mils of air. Perfect. All right, we'll put that back on its little gravy boat there. Pop that off. Whoops. All right.
Those things go flying sometimes, don't they?
They do, you know.
I saw one other nurse shoot some sort of cap way up on top of a cupboard today.
Yeah, that does happen. It's kind of crazy, the pressure behind those things.
Yeah.
All right, so we're just going to clean this port here. Bob, you still doing okay?
Doing great, doing great.
Very good.
Don't want to hurl, so I won't talk to you much here for the next few seconds.
Well, I'm going to need you to talk to me, though, when we're injecting this, okay? I want to make sure you can hear me.
I can do that.
All right, so I'm going to go ahead and prep this vial. And I have drawn up the 2 mils. Take that needle off. Go ahead and put the 2 mils back into there. And then we're going to draw up our 2 mils of Zofran. Alright. I'm going to go ahead and give my little pen a flick here. Have a little bubble in there, and I just want to get that out.
Those little bubbles are sassy sometimes, aren't they?
They are, you know.
What are you going to do? What are you going to do?
Just kind of got to whap them out of there.
Yep.
Alright. Go ahead and pull that out. And I'm going to use the swoop method to recap that needle there. Woo, we got a spinner. Perfect. Alright, so we're going to go ahead and just take that off of there. Okay, and then we're going to dispose of this in the sharps container right away. Okay, so now that this is prepped and ready, I'm going to set it right back down here. And we are going to go ahead and do 5 mils. Remember I told you we had to do 5 mils of that saline flush every time?
Is that that stuff that makes it taste like metal?
It does.
Okay, I'm
Glad
ready.
you remembered it.
I did.
Okay, so again, if you feel any kind of burning, pinching, anything like that, please let me know, okay?
Okay.
All
Lay it on me. I'm
Here
ready.
we go. All right.
Oh, yep. There's that taste
Yeah,
again.
there it goes. Still doing okay?
Doing good. Just trying not to hurl.
I know. I'm trying. All right. So there's the first 5.
Oh, it wasn't so bad. Wasn't so bad.
It's not. Okay. We're going to swab this real quick here.
Is this the good stuff now?
This will be that Zofran.
Oh,
so I'm going to
good.
just clean this
Oh,
site
good.
really quick here. All right, here comes the Zofran. So again, let me know if you have any nausea, vomiting. And so again, we're going to push this over we're going to go ahead and push this over 1 minute, okay?
All right, I'm ready. What do I have to watch for again?
You're going to watch for nausea, vomiting, dizziness, any ringing in your ears, anything like that.
Okay, I'll let you know. We'll just keep talking.
Okay.
You tell me a story, Ashley. I gotta have a story.
Okay, you stop it.